comparing the two CPGs, there has been a fair amount of new evidence that has come out in the interim relating to a number of issues on the ACL CPG. One of the biggest changes has been a shift in terms of better defining the advantages and disadvantages of different graft choices. And so in terms of guiding when it is optimal to use the patient's own tissue or autograft, for example, or how to decide between which types of autograft to use, there is definitely a greater body of evidence in terms of spelling out the advantages and disadvantages of different choices. And so that definitely has evolved quite a bit compared to the previous guideline. Treatment of ACL tears continues to evolve on a number of areas, and there are a number of areas with emerging approaches that did not have enough evidence to be included on the current CPG. Some of those include areas such as repair of an injured ligament in certain circumstances as opposed to reconstruction. There is not enough evidence yet to recommend if and when that might be an appropriate approach, but there is a lot of research going on in that area. Some of the other areas are approaches in terms of augmenting ACL reconstruction with various constructs. There may be some advantages for that in certain situations. And again, that's an evolving area without enough evidence to make a definitive recommendation. There are areas in terms of biologic enhancement, in terms of treatment of ACL tears. And again, there is not enough evidence at this time to make a recommendation for the CPG. Certainly there has been an evolution in terms of the evidence and the guidelines that we developed. It is still a dynamic area in terms of a lot of research and ongoing innovation in the treatment of ACL tears. And so this will be an area where we continue to evolve the guidelines as the evidence comes forth. So I think this is not the final answer, but an evolving answer that will continue to follow in future editions down the road.